2 and...
Hi, I'm Dr. Tom Lagrelius. I'm a family practitioner and geriatrician in Southern California, and I'm here to talk to you today about strokes. Strokes are one of the commonest and most devastating illnesses that people can experience. An individual can go from perfectly well and capable of doing all his normal activities to completely disabled and unable to function. So the main thing we want to do, if we can ever do it, is prevent strokes, not have to treat them afterwards. There are two kinds of strokes, basically. Occlusive strokes, that means that the blood vessel that went to a part of the brain became plugged with something going on in the blood vessel itself. And then there are embolic strokes. And these are strokes in which a piece of material came off somewhere else, like the heart, and traveled through the arteries and blood vessels up to the brain and plugged up the area of tissue that blood vessel supplied. And there are distinct different kinds of strokes. Under the category of occlusive strokes, most of these patients have atherosclerosis. So prevention of the progression of atherosclerosis is critically important in the prevention of strokes. That means we have to keep your cholesterols down, we have to keep your blood sugars down if you happen to be a diabetic, we have to keep your blood pressure down. Blood pressure is a contributing factor to occlusive strokes. So controlling cholesterol levels, controlling lipids, controlling blood pressure, and controlling coagulopathies is critical to preventing occlusive strokes. And so that requires good medical evaluation to make sure that these things have been touched upon. Embolic strokes are more likely to be caused by pieces of material coming off and out of the inside of the heart. For example, if you happen to be in an abnormal heart rhythm called atrial fibrillation, clots tend to form in one of the chambers of your heart, and they can break off and travel through to the left side of the heart, out the aorta, and up into the brain and plug up a blood vessel. These are called occlusive strokes, and they often occur in patients who have abnormal heart rhythms called atrial fibrillation. And patients in such rhythms should usually be anticoagulated to prevent these clots from forming inside the heart, often with Coumadin or with Pradaxa or one of a couple of other drugs that are available for this purpose. So identifying patients with rhythm disturbances, often intermittent rhythm disturbance that set them up for strokes, is very important also. But what happens if you have an acute stroke anyway? What's the most critical thing that you need to do? The most critical thing that you need to do if suddenly a piece of your anatomy doesn't work properly, your arm doesn't work, or you have trouble speaking, or the face droops a little bit, or you're having trouble with balance and coordination, and it looks like it's a stroke, is get to medical care immediately, within a half an hour or an hour, because we have a narrow, small window, a few hours long, during which these days we can open up blood vessels. We can inject drugs, thrombolytic drugs that open up blood vessels and clear the clot completely so that the stroke really doesn't occur. Strokes that go away in less than 24 hours, we call them TIAs, or transient ischemic events. And our goal would be to make every stroke a transient ischemic event by opening up the blood vessel that goes to that segment of critical brain so that it doesn't become dead, like it will if we leave the clot in it for longer than a few hours. Thank you.